high-risk group hemophiliacs, but some people who aren't in any of those high-risk groups have come down with AIDS as well. Doctors and researchers do not understand much about the disease, but our public health service says it's become their #1 priority to find both a cause and a cure. Dr. James Curran coordinates all AIDS activities at the Center for Disease Control in Atlanta. He is joining us this morning from WSB, our ABC station in Atlanta. Dr. Anthony Fauchi is chief of one of the major clinical research labs at the National Institute of Health. He is joining us from Washington, and with me here in New York, Dr. Roger Enlow, who has treated AIDS patients and counsels hundreds of others. He is director of the New York City Office of Gay and Lesbian Health Concerns. Dr. Enlow here in New York, good morning. Gentlemen, good morning.
Good morning.
Dr. Fauchi, there seems to be so much ignorance, fear, and misunderstanding about what's going on with AIDS. Can you tell us, what do we know? What are the best clues you've got?
Well, what we do know is that this is a disease that is almost surely a new disease which has emerged and been recognized as early as 1979, but has been reported to the medical community and to the public in the summer of 1981. It's a disease that is almost surely an infectious disease in that it is all the epidemiological data that we have so far indicates that it can be transmissible from person to person. There are, however, some very important aspects to the communicability in that it appears to require either very intimate sexual contact or prolonged sexual contact, or blood-borne type of transmission, such as one would see in IV drug users who share needles. So although there's communicability, which would make individuals fear that indeed you can spread it like any infectious diseases, there's something very special about the communicability, such that you would not expect it to be transmitted, for example, by mere contact that individuals have between each other.
Like a cold or...
Exactly, yeah. Exactly.
Dr. Curran, how fast does it spread within those 4 high-risk groups and outside the high-risk groups?
Well, the spread among the high-risk groups has been rather gradual, but has consistently increased over the past 2 years since the AIDS was discovered. I think that it's obviously an epidemic which has not yet reached its peak, but the 6% members of no-risk group has remained relatively stable over the past year.
Dr. Enlow, as far as you know, prevention, how can people both in and out of the high-risk groups prevent getting the disease, keep from getting it?
Well, in the high-risk groups, for instance, gay men, there's already been a notable reduction in the numbers of different sexual partners, and that's been one of the earliest recommendations coming from a number of physician groups and, for instance, Gay Men's Health Crisis, a group in New York that's responding to the AIDS problem. There's also been a notable reduction in the number of voluntary blood donations by gay men, and some evidence released last week from the New York Blood Center confirmed that.
Dr. Curran, we understand that there are reports that blood supplies have been contaminated. If people have elective surgery or need blood transfusions, what precautions should be taken by them?
Well, I think although the illness AIDS has been a fairly serious problem among patients with hemophilia, there have been relatively few cases among persons who have received blood transfusions, so that the benefit of receiving blood, a life-saving, resuscitating product, far greatly outweighs the risk. So I don't think that persons who need to receive blood or are having surgery should be unduly concerned.
Dr. Fauchi, there was a headline in a New York paper here yesterday indicating that a cure for AIDS might be near, some experimental work being done with a blood cleansing process and gamma globulin shots. What is that all about?
Well, unfortunately, those are the kinds of things that you might see come out in the lay press prior to peer review among scientific colleagues. There is, right now, at the present time, no known cure for AIDS. We don't even know what the agent is, much less how to cure it. I presume that what was in the New York Times, I did not see the article, was some experimental work that has been done in removing plasma by plasmapheresis and replacing it with normal plasma components. The problem is that things like that may very well show some initial improvement. I have not seen the data, but it is probably the kind of thing that may have initial improvement but not necessarily cure it. When you're dealing with what is most likely a transmissible agent, highly likely to be a virus, I would not imagine that that type of maneuver would cure it. It might ameliorate the conditions, but I doubt it if it would cure it. But then again, this is something that we don't know.
Doctors,